Okay, the next question is it okay for me to continue with HRT? HRT means hormone replacement therapy if I'm getting breast implant surgery next Friday. So first of all, by HRT, we usually refer to estrogen replacement therapy because estrogen has been shown to increase the risk of blood clots during and after surgery. It's not your natural estrogen, but if it's given from outside, it increases the likelihood of thromboembolic incidents or thromboembolic events. But the question is, do we always stop HRT treatments before surgery? What we usually do is we analyze the risk of patient to develop this complication of thromboembolism. There's a risk scoring system. It's called as Caprini risk scoring system, and there are certain criteria to define the risk ratio of the patient. For example, the patient's age, previous thromboembolic incidents, comorbidities, the mobility of the patient, the duration of operation. These are all the risk factors that are mentioned in this risk evaluation. So for plastic surgery, if we're planning a combined surgery, if it's going to last longer than 3 hours, then we usually try to stop HRT. But if it's a straightforward surgery just for breast augmentation or nose operation, these are very straightforward surgeries that usually just last for 2 to 3 hours, then there is no absolute need to stop HRT because the risk increase is minimal. But still, as I told you, if the patient has some additional risk factors or if the patient will not take this even subtle risk increase, then you may try to go and stop the HRT first. But for most of the surgeons, even for elective surgeries, I mean not emergency surgeries, still the risk increase is so subtle for HRT in that setting that we usually do not stop HRT treatments, because when you stop those medications, there will be some rebounds, side effects of stopping those medications as well. There will be increased fluctuations in blood pressure. So even stopping HRT has some side effects that we should consider. And if the patient using some transdermal patches or some gel forms of estrogen, there is almost no need to stop the operation and those medications as well. Therefore, that's the usual approach for most of the surgeons performing the plastic surgery operations.